Let's talk about blackheads and pimples. They look similar, but they're different. A blackhead is a clogged pore where the contents oxidize and turn dark. It's not dirt. A pimple is that same clog, but inflamed, red, and sometimes painful because bacteria has triggered an immune response. The solution isn't to attack your skin. Scrubbing harder only makes inflammation worse by damaging your skin barrier. Tonight, we'll clear both with a professional, barrier-safe method using precise steps and low pressure for effective results without irritation. This is the SHIFTGLO method. Let's begin. First, S. Soften. The goal is to loosen hardened sebum plugs. Take a clean face towel, run it under warm, not hot, water, and press it onto your blackhead-prone areas for 2 to 3 minutes. This gentle warmth helps soften the pore contents. If you're wearing heavy SPF or makeup, follow with a quick swipe of micellar water. Remember, we are softening the contents of the pore. Pores don't open and close with heat or cold. Next, H. Hygienic double cleanse using the 60-60 method. First, an oil cleanse for 60 seconds on dry skin. Oil-based cleansers are brilliant because like dissolves like. The oil binds to sebum, makeup, and sunscreen, lifting it all without stripping your skin. After a minute, wet your hands and continue massaging. The oil will emulsify into a milky liquid, meaning it will rinse away cleanly, taking all the dissolved grime with it. Then, rinse thoroughly. Now for the second 60, a water-based gel cleanse for another 60 seconds. This removes any remaining residue. Choose a gel with salicylic acid for congestion or calming ingredients like heart leaf for sensitive skin. The feeling you want after rinsing is glide, not squeak. Squeaky clean skin is stripped skin. Gently pat away excess water, but leave the skin slightly damp. Now for I, intelligent acids. We'll use a BHA or salicylic acid at a low concentration of 0.5 to 1%. BHA is oil-soluble, so it can penetrate into the pore lining and dissolve congestion. Apply it using a map press technique. Saturate a cotton pad and press it firmly onto your blackhead map, the nose, sides of the nose, and chin, for a few seconds in each spot. If your skin is too sensitive for daily BHA, rotate it with gentler alternatives like PHAs, LHAs, or a low-strength lactic acid 1 to 3 times a week instead. For an extra boost, you can add 2 targeted treatments. First, an enzyme pop-in. Apply a thin layer of a papaya or pineapple enzyme mask for just 45 seconds to dissolve the top layer of dead skin. Then, apply a clay mask just to your T-zone for 6 to 8 minutes. Rinse when it's about 80% dry. What you must skip are gritty physical scrubs and harsh spinning brushes. This aggressive friction creates micro tears, damages your barrier, and can trigger more inflammation. Time for F. Focused release. This is manual extraction, and it must be done correctly or not at all. First, assess your lesions with a traffic light system. Green light, a surface blackhead or a whitehead with a visible tip. These are safe to address. Yellow light, a closed, flat bump. Do not pop it, treat it with topicals. Red light, a hot, deep, painful cystic lesion. This is a no DIY zone. See a professional. For any green light extractions, hygiene is non-negotiable. Wear gloves, sanitize your tool with alcohol, and ensure the skin is dry. Gently stretch the skin taut around the pore to anchor it for a better angle. For a blackhead, place the loop of your extractor tool past the pore, then apply low, even pressure as you roll it back over. For a whitehead, use 2 cotton swabs at a 45-degree angle, press gently in, and then roll upwards. Never use your fingernails. And always follow the rule of 2s. Give it 2 gentle tries. If the clog doesn't release, it's not ready. Walk away. Forcing it will only cause trauma and potential scarring. Immediately after, T. Tame inflammation. An extraction site is a tiny open wound. Give it 1 gentle sweep with a sterile saline solution, pat dry, and apply a micro dab of salicylic acid. If there's any fluid, cover it overnight with a hydrocolloid patch to absorb drainage and aid healing. To calm the surrounding skin, press, don't swipe. a soothing serum with ingredients like Centella asiatica or panthenol. If the area is red or puffy, gently roll a wrapped ice roller over it for 30 to 45 seconds to reduce swelling. Now we move to daily care. G. Guard. Every single morning you must protect your skin. Use a lightweight, non-comedogenic sunscreen with at least SPF 30. UV exposure darkens post-acne marks, making them linger. And L. Lightweight moisture. Even oily skin needs hydration, as dehydration can trigger more oil. Seal everything in with a gel-based moisturizer with ceramides to support your skin barrier and hyaluronic acid for oil-free hydration. Finally, O. Optimize your nights with a skin cycling routine to prevent overexfoliation. Night A is your BHA treatment night. Night B is for retinoids, which accelerate cell turnover to prevent clogs. Apply a pea-sized amount, buffering with moisturizer if you're sensitive. Night C is for recovery. No actives, just cleanse and apply a barrier-repairing moisturizer. Then repeat the cycle. For stubborn issues, here are some targeted add-ins. For persistent red or brown marks, apply a thin veil of azelaic acid on your recovery nights. For very oily zones, use short contact therapy, either a benzoyl peroxide 2.5% wash for 60-90 seconds or a 5 to 10% sulfur mask for 5 to 10 minutes before rinsing. And don't forget the easy wins. Change pillowcases twice a week, wipe your phone daily, cleanse after a workout, wash makeup tools weekly, avoid heavy creams on your T-zone, and most importantly, keep your hands off your face. If you're tempted to pick, use a pimple patch. Consistency is key. Within 48 hours, active spots will be calmer. After a week, your T-zone will feel smoother. And by the 4-week mark, you should see a visible reduction in blackheads and new breakouts. This is a framework you can adapt. For a personalized routine, comment with your skin type and toughest zone, and I'll pin a custom mini map for you.